before I start with the trigeminal nerve, and I'll tell you that why I'd want to start with the trigeminal nerve, because trigeminal nerve is the function of trigeminal nerve is not only to carry the sensation from the face. Trigeminal nerve is helping other nerves also to complete their function. Facial nerve, glossopharyngeal nerve, oculomotor nerve, all these nerves which are parasympathetic cranial nerves, they cannot reach their target organ or target structure or target muscle or gland, whatever, agar trigeminal nerve nahi hoga to. What I have personally noticed, I don't know whether it is with you also, people who are done with head and neck in their college or still going on, we don't pay too much attention to trigeminal nerve. We talk more about the facial nerve and glossopharyngeal nerve, but not too much about the trigeminal nerve. But I tell you, if you really want to understand the concept of in the head and neck, you should be knowing about the trigeminal nerve in the most detailed way. Before we start with the nerve, guys, I'll tell you something here, that the ganglions that we have to discuss along with the nerves, those ganglions are the parasympathetic ganglion. There are parasympathetic ganglion, and there are 4 parasympathetic ganglion in the head and neck, and every single parasympathetic ganglion is important to understand innervation of the glands. And also for you people, it is a question also. A short note question on the parasympathetic ganglion is it's a very, very frequently asked thing. The 4 parasympathetic ganglion are, we have number 1, we got ciliary ganglion. There is a ganglion called a ciliary. Just write down the name for now, ciliary ganglion. We have a ganglion which is called as the pterygopalatine ganglion, guys. We call it pterygopalatine ganglion. Either you call it pterygopalatine ganglion. This is also called as the sphenopalatine. This is also called as the sphenopalatine ganglion. Ek hi baat hai. Actually, pterygoid plates. The pterygoid plates are the part of sphenoid bone. This is I'm telling you this for the people who have not done anything in the head and neck yet. So guys, pterygoid plates, we have medial pterygoid, lateral pterygoid plates are there in the skull, and those pterygoid plates are the part of sphenoid bone. So ek hi baat, aap bolo pterygopalatine ganglion or sphenopalatine ganglion. Third, and probably the most important ganglion to be remembered, is the otic ganglion. Otic ganglion. And number 4 is the submandibular ganglion. So these are the 4 parasympathetic ganglion we have, and I want all of you to be like very well aware of all these ganglion, because when you start reading a ganglion individually from the book, I mean, again, the people who have done with their head and neck in the college, agar aap ek ganglion, if you just start reading just a ganglion only, I can guarantee you will not understand more than 30% of things. Just maximum 30% you can understand there, because the branches which are coming out of the ganglion are not only the ganglionic branches, are also the branches of some nerves which are connected to ganglion. So there are certain concepts which we have to understand in a sequence. And again, you will find these ganglions are so interesting. And I mean, you will kind of appreciate that how our body is built. I mean, how these ganglions, they work. God has designed our body in such a way. Everything is having its specific function and it works in a certain manner. Okay. Parasympathetic ganglion, see, I've written the spelling wrong. Parasympathetic ganglion, 4 of them, and they have something in common to understand. Every ganglion is having a topographic nerve and a functional nerve. Most of it, I mean, if not say every. What I'm trying to say here, guys, agar maan lete hain beta ye ek nerve hai. Let's say this is a nerve here, and this is a ganglion which is hanging to it. Right? Let us say there's a nerve here, and you can see a ganglion which is hanging to this nerve here. What I'm saying is, like, this is one of the parasympathetic ganglion, ciliary, pterygopalatine, whatever it is one of the parasympathetic ganglion. Most of these parasympathetic ganglion, they have 2 types of nerve. A nerve which is called as a topographic nerve, and a nerve which is called as a functional nerve. A topographic nerve and functional nerve. See, what is the meaning of a topographic nerve? Topographic nerve. Topographic nerve means the nerve which is just hanging the ganglion. I mean, this is the one which is giving an anatomical position to the ganglion. It is also called as a morphological nerve. Topographic nerve means the nerve which you will see that will go inside the ganglion like this, and then will come out without relaying inside the ganglion. Look at that. Andar gaya, bahar aa gaya. It is not relayed inside. It is simply going inside and comes outside here. Usually what should happen, the nerve should come inside, relay there, and then post-ganglionic fiber should go out. But no, topographic nerve simply goes in and comes out. That is a topographic nerve. Now what is topographic nerve? We'll see. And then the second type of nerve that you will see are called as functional nerves. Functional nerves means the nerve which will go inside and relay there. Now it is quite evident that which nerve will be functional now, guys. What ganglions are we talking about? We are talking about parasympathetic ganglion. So which nerve will be functional? The parasympathetic nerve. How many cranial nerves were parasympathetic? 4 of them. 3, 7, 9 and 10. So these 4 nerves are parasympathetic cranial nerve, and these nerves obviously they're supposed to go inside the ganglion and relay also. They are functional nerve. इनको तो काम करना है. Okay. So what functional nerve will do? Now look at this, guys. A functional nerve will come inside the ganglion and this will relay there. You can see it is ending here and relaying here. So functional nerve will come and relay there. Now this is the most important thing to understand to have a good concept about the ganglion, guys. Functional nerve better come inside the ganglion, relay in the ganglion, but it will never go out of the ganglion. You will never see any of the functional nerve coming out of these ganglions, ciliary ganglion or pterygopalatine or otic ganglion, whatever it is. When you see 3rd nerve, 7th nerve, 9th nerve, whatever nerve enter inside these ganglions, they will relay there, but you will not see these nerves coming out. If these nerves will not come out, then what is the point of relay? क्यों कर रहे हैं हम relay? अंदर फायदे क्या हुआ? अगर आप बाहर ही नहीं आएंगे तो why you relaying inside? Well, the point is the post-ganglionic fibers. Guys, look at this. The post-ganglionic fibers, which will start from here, the post-ganglionic fibers will start from here. They actually will join with the topographic nerve only. That is how they're going to come out. So they are coming out, but not themselves. 3rd nerve itself or 7th nerve itself is not coming out. It is simply going to join with the topographic nerve, and topographic nerve will do rest of the function. So इसको ऐसे मान लेते हैं, like if I am a topographic nerve, when I entered inside the ganglion, I was like free. कुछ नहीं यार, बस अंदर जाना है, बाहर जाना है. I will go inside this cave and I will come out here. But when I went inside the ganglion, some added responsibility was given to me, and that I have to carry what fibers? Post-ganglionic parasympathetic fibers, isn't it? They are post-ganglionic and obviously coming from what nerve? Parasympathetic nerve. So these, the one which I drew with the green color here, these are post-ganglionic parasympathetic fibers which are carried by what nerve? By the topographic nerve. There is one more possibility. Why it is joining with the topographic nerve? ऐसा क्यों हुआ यार कि why it is joining the topographic nerve? Because topographic nerve is already reaching to certain area. अब मान लेते topographic nerve is reaching, just an example, don't draw this. Let's say it is reaching a lacrimal gland. It is, let's say it is reaching the lacrimal gland. So what facial nerve will do? Facial nerve has to supply the lacrimal gland. So facial nerve will come inside a ganglion and it will relay there. And what will happen? Because already a nerve is reaching the lacrimal gland, so the post-ganglionic fiber will just join with it, so that that nerve will guide those post-ganglionic fiber to the lacrimal region. Generally ऐसा होता है आपको, in parasympathetic ganglions you will see 2 nerve entering inside. Generally one is topographic, one is functional, but the only nerve which comes out is topographic. But that topographic nerve is having the functional fiber also inside it. Post-ganglionic functional fibers are inside. There is one more possibility. Now let us say if the gland that you want to supply or the smooth muscle that you want to supply is very close to ganglion only. मान लो बेटा यहीं पर ही है, अगर gland को यहाँ पर ही present है, it's very close. Just as an example, ये मान लेते submandibular gland है, whatever gland it is just some gland. And if that gland is very close to the ganglion, then what will happen? In that case, post-ganglionic fibers को जरूरत ही नहीं उस nerve की, they will directly go and supply the gland also. They will directly can go and supply the gland as well. You getting my point? So this is, it's a very simple concept, but because of this concept, people, I mean, those who don't know about this, they are never able to understand the parasympathetic ganglion. When you think of a parasympathetic ganglion, what you need to keep in your head is that a functional nerve, a topographic nerve will be seen coming inside and that will go. Then you will see a functional nerve coming inside there, relay there and end. Functional nerve will come inside and you will never see 3rd, 7th, 9th or 10th nerve going out of the ganglion. No, they will not. Post-ganglionic fibers के पास अब 2 options हैं. If a post-ganglionic fiber has to supply the gland which is far off, then they will join with the topographic nerve and will reach there. And if post-ganglionic fiber has to supply the gland which is very close to the ganglion, वहीं से nerve निकल के बाहर आ जाएगी और supply कर देगी उसको, whether it is smooth muscle or it is gland. right? I'll make you write this also, but look at this. And one important point is, guys, topographic nerve for all four parasympathetic ganglion. This is such an amazing point. Topographic nerve for all four parasympathetic ganglion is trigeminal nerve. Say hello to trigeminal nerve. Imagine how important is this. Trigeminal nerve, ophthalmic, maxillary, mandibular. It is topographic nerve for every ganglion, guys, for all the four. यानी कि बेटा अगर आपको facial nerve समझना है, if you want to understand third nerve, seventh nerve, ninth nerve, you should know about the fifth nerve first, because I can only understand the facial nerve and all till here. After that, how exactly the fibers are reaching the target structure, that depends on which nerve only, topographic, and which is topographic, the fifth nerve. So that is why I'm saying कि I'm stressing so much on the fifth nerve. You need to have a good knowledge of the fifth nerve, so that you have a very good orientation of the nerve complex of the head and neck part. चलो जो सेम चीज जो हमने अभी ड्रॉ करी यहाँ पे, I wanted to write the two important points here. First important point we said is the nerve, ताकि आपको याद रहे, the nerve which connects the ganglion, which connects the parasympathetic ganglion, I will say, the nerve which will connect the parasympathetic ganglion topographically, so the nerve which is connecting the parasympathetic ganglion topographically will also carry post ganglionic, कौन से फाइबर बेटा, post ganglionic parasympathetic fibers. That's what you can see in the diagram. They're also carrying these fibers. Post ganglionic parasympathetic fibers are carried by the topographic nerve. So the nerve which connects the ganglion, which connects the parasympathetic ganglion topographically, that is also carrying the post ganglionic parasympathetic fibers. One point. And the second point we said is that all ganglions, all parasympathetic ganglion are topographically connected. Topographically connected to which nerve beta? To the trigeminal nerve. They're all topographically connected to trigeminal nerve. कोई नहीं बताएगा ये वाली बात, but this is so important. This is something which is an extract of all the parasympathetic ganglions. It is merely a stupidity if you start reading the ganglion without understanding these basic concepts here. Because I want you people, when you go and read the ciliary ganglion or pterygopalatal ganglion, तो ये चीज आपके दिमाग में होनी चाहिए कि what can I expect from this ganglion? I can expect few things in the ganglion. एक topographic nerve होगा इसमें, एक functional nerve इसमें आके relay कर रहा होगा. Then post ganglionic fiber either will be joining the topographic nerve, or it will give a direct branch to the structures which are close by, like if any gland or smooth muscle, if it is close by, it will give a direct branch only. Is that clear, guys? Is that clear? So if you understood this point here, then we are in a very good position to start with our nerve, that is the trigeminal nerve. Let us talk about the trigeminal nerve. आराम से चलेंगे. I'll keep showing you a lot of pictures in between. Keep drawing on those pictures also. We'll send you those images as well. But a trigeminal nerve is having three components. As we all know, there are three parts of the trigeminal nerve. We have ophthalmic division, or you can say ophthalmic nerve. There is this maxillary nerve, and we have mandibular nerve. And I'll tell you before I start, though, this is the reason, bache, I did not discuss the nerve supply of the face. In the face, many people ask me, sir, why did not we discuss about this innervation? If you know about ophthalmic nerve, maxillary nerve, and mandibular nerve in detail, automatically these nerves are the one which are coming out after supplying the orbit structure or maxilla or mandible. They will come out and they will supply the skin on the forehead, scalp, this below the orbit, and mandible, maxilla region. All skin will be supplied by that only. So now today, if I tell you the sensory supply of the face, that will make more sense to you because you will knowing about those branches. उस दिन हमने nerve बनाई होती directly, so you just write the like supratrochlear, supraorbital nerve are supplying the scalp. We discussed that day. But where those supratrochlear, supraorbital nerves are coming from, how exactly they are coming above and supplying, that answer will be, you will get that answer today in this part, in this trigeminal part. Acha, ophthalmic nerve and maxillary nerve, please note that these are purely sensory nerves. These are sensory nerves, whereas mandibular nerve is a mixed nerve. Mandibular is a mixed nerve. sensory nerves. So ophthalmic and maxillary will just take the sensation. Principally, they will take the sensation, and mandibular nerve is the one which is a mixed nerve, and this mandibular nerve, it is having some sensory function also, and it is having some motor function also, some sensory as well as some motor function as well. Just to give you an idea about that, how these nerves are starting. I mean, if I put that picture once again for you, you might have a question. Let me just rub off all these. I said slowly and gradually we'll cover up this entire thing, and then you will understand the nuclei here. But the trigeminal nerve is having this two main function, motor and sensory. The sensory nucleus is a huge nucleus. You can see it is highlighted on one side here. Look at this highlighter here. That's a mesencephalic nucleus. Here is a principal sensory nucleus. And look at this long nucleus, which is even going to the spinal cord, upper part of the spinal cord. That's what nucleus? Spinal nucleus. So whatever I highlighted here, it is what? It is a sensory nucleus of the trigeminal nerve. Sensory nucleus of trigeminal nerve. You can see the trigeminal nerve actually is coming inside. Okay. And in this picture, guys, blue color has shown the sensory nucleus, and red they have shown with the motor nucleus. Although obviously we have both present on both the side, but just to make it a little simpler. And this one here is the motor nucleus of the mandibular nerve. Because this is ophthalmic, this is maxillary, and that is mandibular. You can see a motor nucleus of mandibular nerve from where the this motor nerve will come out, the mandibular nerve will come out. And here again, that is ophthalmic, maxillary, and mandibular. That is how the sensory nerves are coming inside and reaching this trigeminal ganglia. The blue one are the sensory, and this red one are motor. What is the location, bache? What is the location? This nucleus, the motor nucleus of mandibular nerve, and this nucleus is the sensory nucleus of the trigeminal nerve, where they are present. For that, if I again take you back to this picture here, there we go. I already marked it here, but I still want to do it again. Okay. Mandibular. Motor nucleus of mandibular nerve, there it is. Motor nucleus of mandibular nerve, here it is. And sensory nucleus, look at this huge sensory nucleus. Everything, this whole thing is a sensory nucleus only for trigeminal nerve. So which two column, guys? SVE and GSA. That is why when you start discussing the nerve, trigeminal nerve ke do hi function hai. Motor function to supply the muscle of mastication, sensory function to take the sensation from the face here. And that is covered in these two columns, SVE column and GSA column. Pharyngeal arch muscle and carrying the sensation from the somatic structures. So that is where we need to start from, that functional columns. I'm writing these functional columns in the beginning because we already discussed the cranial nerve nuclei. Functional columns, there are two functional columns. One is what, beta? One is SVE. Why SV? Because it is going to supply the muscles derived from pharyngeal arches. Which muscle? Muscles of mastication. We will see that. How? And second column is GSA. Why GSA? Well, it is taking sensation from face. The trigeminal nerve will take the general sensation from the face. Kuch bhi ho sakta hai. Proprioception ho, pain, temperature, touch, pressure, whatever, that will all come into GSA. That's why we have the two columns for what now? The trigeminal nerve. Sorted? So we have, guys, we are going to discuss ophthalmic nerve and maxillary nerve together because they are sensory, and then I will have a separate discussion on the mandibular nerve, and then in the pictures I'm going to show you all, but I have to like do it in a components here. Pehle ophthalmic nerve discuss karenge. I'll show you an image from the atlas. I want you to identify every nerve in that. फिर वापस आके maxillary करेंगे. Again we'll compare it. फिर mandibular करेंगे. Again we'll compare it. So we have to do the comparison with the atlas image. Again, I have to show you something before we start. Beta, in the cranial cavity, I again really expect आप लोगों ने आज ये शायद वीडियो देखा हो. जिन्होंने नहीं देखा हो बेटा, प्लीज जाके इस वीडियो को देखो. देखो, if you go to this cranial cavity, this here is what? This is the anterior, middle, and posterior cranial fossa you're looking at. Okay. In the posterior cranial fossa, guys, this bone here is a petrous part of temporal bone. I've discussed this in the video also. That is a petrous part of temporal bone. Petrous means stony part. It's like a stone. Petrous part of the temporal bone, and this is the apex of the petrous part of temporal bone. Now, close to the apex of the petrous temporal bone, we have a ganglion which is placed here, and that ganglion is called as a trigeminal ganglion. The big trigeminal ganglion is present where? It is present close to the apex of petrous temporal bone, We have a depression there. We have a cave over there, a cave which is made up of dura mater. We will discuss that in the dural folds also. We call it a Meckel's cave. बस याद रखो कि यहाँ पर एक ट्राइजेमिनल गैंग्लियन रखा हुआ है. Brainstem कहाँ पर होगा? Guys, brainstem will be somewhere here. This is the brainstem, like this is a brainstem here. So obviously brainstem will give off the trigeminal nerve. From the brainstem, the trigeminal nerve will come out. Then it is going into the trigeminal ganglion, and from the trigeminal ganglion, the nerve will divide in three parts: ophthalmic, maxillary, mandibular. But ophthalmic nerve will go into this fissure, which is called a superior orbital fissure. That is V1, ophthalmic nerve. And can you see a fissure over there? That is called a superior orbital fissure. Maxillary nerve will enter into this foramen rotundum. That is another foramen present below superior orbital fissure. Whereas mandibular nerve will go through this foramen, that is called as foramen ovale. That is mandible. Ophthalmic, maxillary, and mandibular. Like that's ophthalmic, maxillary, and mandibular nerve. Three nerves coming out of the trigeminal. Just to give you a picture that where these nerves are going, and we will discuss them in detail. But the trigeminal ganglion is a sensory ganglion. That means I'm only looking at the sensory part of ophthalmic, sensory part of maxillary, sensory part of mandibular. We already said ophthalmic and maxillary are purely sensory. So इनमें तो बस ये दो ही हैं. But mandibular nerve is a mixed nerve. Mandibular nerve is a mixed nerve. So as we saw that in the brainstem, this whole thing is coming from where? It is coming from this huge nucleus connected to the trigeminal ganglion, and then the nerves are going out. But we also said that we have a motor nucleus of mandibular nerve, beta. Motor nucleus of mandibular nerve is there somewhere. That mandibular nerve, motor nucleus of mandibular nerve will come separately, will go close to the ganglion, and then it will run along with the sensory part and join with it at the level of foramen ovale. It will join with it at the level of foramen ovale. That is the motor component. The red one here is a motor part, and black one here is a sensory part. So we said trigeminal nerve with two parts, एक sensory part and motor part. They both will go and join close to this foramen, or at the level of this foramen. Beta, that foramen is called as foramen ovale. Look at the shape. It's an oval shaped foramen. So this foramen is called as what? Foramen ovale. And the foramen which is present behind it is called as foramen spinosum. Actually, it is very close to the spine of the sphenoid bone. We will discuss that later. That is called as foramen spinosum. Maxillary nerve is going from which foramen? That is called as foramen rotundum. And this ophthalmic nerve is basically going to go through which fissure? This fissure here is called as a superior orbital fissure. That is superior orbital fissure. Is this thing clear to you? ये सिर्फ हम beginning की बात कर रहे हैं. अभी तो what they will supply, there's a lot to be discussed here, but I'm just telling you that how this thing will originate and how they will leave the cranial cavity. After that function तो अंदर बाहर जाके करेंगे. So I repeat again very quickly, guys. If you follow the black color here first, this is a trigeminal nuclei, mesencephalic, principal sensory, spinal nucleus, and all that. So the nerve which is coming out from there, that is a sensory part of trigeminal nerve. And that sensory part of trigeminal nerve will go into a ganglion called as a trigeminal ganglion. It's a ganglion. It's a sensory ganglion, which is giving off three branches: ophthalmic, maxillary, mandibular. Beta, ophthalmic goes into the superior orbital fissure, and that is how it enters into the orbit. Maxillary nerve will go from the foramen rotundum, and then it will come onto the side here. It will come onto the side into the infratemporal fossa. I will tell you what is that. And mandibular nerve goes through the foramen ovale. That also comes into the infratemporal fossa. The foramen is called as foramen ovale. But mandibular nerve is a mixed nerve. तो ये nerve का जो origin है वो एक root से नहीं दो root से है. Sensory is coming from trigeminal ganglion, and motor root is directly coming from the motor nucleus of mandibular nerve, which was present in what column? SVE column, pharyngeal arch wala column. So that is coming directly from there. This is how the trigeminal nerve will start its journey. ये सिर्फ शुरुआत की बात थी. If I again show you a small comparative picture to see how these nerves will look like, देखो बेटा, there's another picture to show you that. Although we'll discuss this picture a little later. Brainstem, so that's a trigeminal nerve coming, right? This ganglion here is a trigeminal ganglion. This is ophthalmic nerve, this is maxillary nerve, and this is a mandibular nerve. Superior orbital fissure में जा रहा है, ये rotundum के अंदर, and that is going through foramen ovale. Motor branch they have not shown. These are different nerves. Don't follow them. That is third and fourth nerve. So the motor branch which is not shown, the motor branch will come like this and also will go out of the foramen ovale only for the mandible. Clear? Sure. If you understood this part, so basically the reason I was telling you so that we can start our discussion directly from the trigeminal ganglion. Before the trigeminal ganglion in the brainstem and everything, that's a part of neuroanatomy. So let's not complicate things for us. So to keep it simple, guys, if possible, take a fresh page or at least half of the page and start drawing from very much from the left side of the page. So guys, what we said that, okay, the trigeminal nerve will come from the brainstem and it will go into this ganglion, which is called as a trigeminal ganglion, which is going to divide into these three: ophthalmic, maxillary, mandibular. And we said this trigeminal ganglion is present on a shallow depression on the petrous part of temporal bone. There is a cave present over there. That cave is called as a Meckel's cave. What is Meckel's cave? We will discuss that in the durameter. So this cave, this depression here is called as the Meckel's cave. Label it exactly when I'm doing it, क्योंकि हमें बाकी चीजों के लिए जगह बचानी है. तो बेटा, that is Meckel's cave. This ganglion here is called as a trigeminal ganglion. Either you call it trigeminal ganglion. There's another name given to this. It is also called as a Gazarian's ganglion. Trigeminal or Gazarian's ganglion. एक छोटी सी पिक्चर दिखाता हूं आपको, so that you have an idea about that what we are going to draw. What orientation is that, guys? Just look here for 1 second, all of you, please. The things that we are going to draw are actually in this orientation. In this orientation, we've just started from here, guys. What ganglion is that? That is a trigeminal ganglion, right, beta? This depression here, which is actually made up of the dura mater, actually, that depression in the petrous part of temporal bone, where dura mater will form a cave for it, called as a Meckel's cave. So that's a trigeminal ganglion or Gazarian ganglion. And as you can see in this picture here, that's an ophthalmic nerve. You can see going into the orbit. That is maxillary nerve going out of that foramen rotundum. It's a side view, it's a sagittal section. And that is mandibular nerve, which is going out of foramen ovale. एक एक करके लेते हैं. Now, before I start there, can you notice something here? That ophthalmic nerve, before entering into superior orbital fissure, it is dividing into 3 branches. वो पहले अंदर नहीं गया. Ophthalmic nerve divides into 3 branches and then it goes inside. Let me put the superior orbital fissure for that matter. Let us say this here is the superior orbital fissure. जितना जरूरत है उतना ही ड्रॉ करना है. Don't label anything unnecessarily. Otherwise, this diagram will become very complicated. Guys, this is SOF. What is that? Superior orbital fissure. Superior orbital fissure. Okay. So what I'm saying, obviously, इसके आगे क्या है? पूरा orbit होगा यहाँ पे. Everything that we have is orbit here. Eyeball and everything, other muscles of the eye, all that is present here. Don't have to draw. Ophthalmic nerve, beta, ophthalmic nerve will start from here. And as I said, ophthalmic nerve, before entering into the superior orbital fissure, it divides into 3 branches. 1, 2. This is a schematic line diagram. So हमारी branches जरूरी नहीं sequence में हो. So I will show it in the atlas, but this is not necessarily there. They're not necessarily present in the sequence here. What nerve is that, guys? This is the ophthalmic nerve, right? I'm writing V1, ophthalmic nerve. The 3 branches which are entering into superior orbital fissure, before superior orbital fissure, they're given off. Well, the name goes like we have a nerve called as the frontal nerve. Then there is a nerve called as the nasociliary nerve. And then there is a nerve which is called as the lacrimal nerve. 3 branches, guys. Please try to label them जैसे मैं कर रहा हूँ यहाँ पर. उसके ऊपर नीचे कुछ नहीं लिखना, आपका diagram spoil हो जाएगा, because we still have to draw certain things below also. So frontal nerve, nasociliary nerve and lacrimal nerve, they are all entering into the orbit here. Frontal, nasociliary and lacrimal nerve. Not necessarily in that sequence, but I am drawing them in this sequence for our convenience only. I'll tell you why, what is the reason for using this sequence here. Frontal, nasociliary, lacrimal. But a frontal nerve, as the name suggests, frontal nerve, it actually will go further and divide into 2 branches. Now these 2 branches will make more sense to you. That is called as the supratrochlear nerve. नाम सुना है? Supratrochlear nerve and supraorbital nerve. Supratrochlear and supraorbital nerve. You already know what they are doing. They're coming from here and they're supplying the skin of the forehead and the skin of the scalp also. Supratrochlear, supraorbital. I'll tell you more about these nerves, but just look at this first. Then next we said what? Nasociliary. Now break this name, guys. Naso and ciliary. Naso and ciliary. That means this nerve must be having some contribution to the nose, must be supplying something in the nose. and ciliary because it is having connection with ciliary ganglion. This nerve is topographically connected to what ganglion? Beta, ciliary ganglion. This is connected to what ganglion? To ciliary. This is what we said, guys. We said all ganglions, all parasympathetic ganglions are topographically connected to what? To the trigeminal nerve. पहला ये आ गया आपके सामने. That's the first one. Ciliary ganglion is topographically connected to nasociliary nerve. अब इसका क्या इंपॉर्टेंस है वो हम देखेंगे थोड़ी देर में. This nasociliary nerve will give off two branches. One is called as a posterior ethmoidal nerve. One is called as an anterior ethmoidal nerve. Posterior ethmoidal, anterior ethmoidal. We'll discuss that. And then finally it will come out and will give off a nerve that is called as an infratrochlear nerve. Infratrochlear nerve. Look at this. That is supratrochlear and that is infratrochlear. Actually, one goes above, one goes slightly below. So one is supratrochlear, one is infratrochlear. So infratrochlear is basically the continuation of, or you can say it is a branch of which nerve? Nasociliary nerve. PEN and AN is zarur likhna, guys. That is posterior ethmoidal nerve and anterior ethmoidal nerve. I'm going to discuss these nerves in detail, but just write it now. Posterior ethmoidal nerve and anterior ethmoidal nerve. And then obviously we have a lacrimal nerve. Now lacrimal nerve main function obviously is to supply what gland? The lacrimal gland. So it is going to supply the lacrimal gland. But that is not it. Actually, lacrimal nerve की एक branch ऐसी भी होगी which will pierce the orbital septum and come out to supply the skin outside. There's a branch which will come out to supply the skin of the upper eyelid. It will supply the skin of the upper eyelid. We'll see what branch it is. So it is going to supply the skin of the upper eyelid. This is what the ophthalmic nerve is doing. Ophthalmic nerve is giving off three branches: the frontal, the nasociliary, the lacrimal. Frontal nerve, it divides into supratrochlear and supraorbital. Nasociliary nerve connected to ciliary ganglion, then it is giving off posterior ethmoidal, anterior ethmoidal. Infratrochlear nerve is the continuation, and lacrimal nerve, after supplying the lacrimal gland, it also gives off a branch which ultimately comes out and supplies the skin here. But in some nerve pe nazar zarur rakhna, the one which are coming out. See, this is coming out, this is coming out, this is coming out, this one is also coming out here. So when we talk about the sensory supply of the face, you will see all these small nerves coming out. Supratrochlear, supraorbital, infratrochlear, and the branch of lacrimal nerve, the branch of lacrimal nerve coming out. They all will be there and will be supplying the skin of the face. Now, this is schematically, this is just a schematic representation. Let me try to draw this picture in another view, and I'll show you a picture from the atlas also, where you try to find out these nerves, how they gonna look like. But I wanted to draw it also. So leave this page because ये page हमें use करना है. Go to the next page or maybe 2 page after, whatever, and let us have a discussion on this in a horizontal section. If you take a horizontal section from the orbit, then how this ophthalmic nerve will be seen inside? We have three branches here: lacrimal, frontal, and nasociliary. Now look at me, guys. All of you, please look at me. Let us say this is the orbit here. This is the orbit here, the right orbit you're looking at. It's very easy to understand that कौन सा nerve कौन सी direction में जाएगा. Lacrimal gland is present here. It is present on the lateral side. It is present on the upper lateral side of the orbit. So lacrimal nerve you will see running along the lateral wall of the orbit. Inside only, but along the lateral wall. Let me use my Mr. Skull here. Look at this. So guys, the nerve that you see which is running here on the lateral side will be the lacrimal nerve, because lacrimal gland is somewhere in the upper part here. Right? Frontal nerve, because frontal nerve has to divide supratrochlear, supraorbital. So the nerve which is running along the roof, जो बिल्कुल roof से चिपक के चल रहा होगा ऐसे, the nerve which will be running on the roof here, that will be what? The frontal nerve. And the nerve which is on the medial side, on the medial wall, actually it will reach the medial wall, that is nasociliary nerve. So it was not originally to the medial side, it will reach the medial wall. How will you appreciate these three nerves together? And that is possible only through a transverse section. देखो बच्चे, transverse section तो ये भी है. There is a transverse section. This is sagittal section here. There also is a transverse section here, right? So I'm going to draw something like this only. So this is the septum. The nasal septum will be here. So this is the medial wall basically. Orbit का medial wall ऐसे होता है, सीधा straight, and lateral wall is oblique. So when you draw the orbit in a transverse section, one wall is straight of the orbit and other wall is like this here. I will come back to this picture and obviously will ask you to identify the nerve. But first, I want you people to draw it with me, guys. If let's say this here is the medial wall of the orbit, and this is the lateral wall of the orbit. Medial wall and lateral wall. Here is the eyeball. Up transfer section, dekh rahe beta, this is the transfer section. And obviously the nerve which is running from here, that is the optic nerve. कोई doubt ही नहीं है इसमें, that is an optic nerve. Let me highlight that for you. That is the optic nerve. So superior orbital fissure will be somewhere at the back here. यहाँ से वो तीनों branches enter करेंगे. Ophthalmic की all the three branches. Now let me not draw the frontal nerve because frontal nerve is very much at the top here. So when you take a transverse section, frontal nerve को काटना पड़ेगा आपको. Even when you will do the dissection of the orbit, I hope the colleges will open and you'll get to dissect some part. So when we do the dissection of the orbit, we start from above. हम cranial cavity से ऊपर enter करते हैं. We go from the cranial cavity. We remove the roof of the orbit, and the first nerve you will see the frontal nerve only. So then you will see frontal nerve. You will see some muscles there. You will remove that nerve and the muscles, and the remaining two branches can be seen here. But a lacrimal gland, we said it is present more toward what side? Toward this side. Lacrimal gland is here. Lacrimal gland is here. This is lacrimal gland. Okay. So the lacrimal nerve that you will see will enter through the superior orbital fissure, will be seen running and supplying the lacrimal gland. And we said then is a branch which will also go out and supply the upper eyelid. What nerve was that? That was the lacrimal nerve. That's lacrimal nerve. Running along the lateral wall of the orbit. Orbit की lateral wall के साथ run कर रहा है. The nerve that you will see, which is actually crossing from medial to lateral side, above the optic nerve. This is optic nerve. You all know that that's optic nerve. Now look at this, guys. This is important. This nerve, the second nerve I'm talking about here is nasociliary. But a nasociliary nerve will go like this. It will cross the optic nerve from lateral to medial side. And then it will run close to the medial wall of the orbit and ultimately comes out as well. See, what is it doing? We said this nerve, this nasociliary nerve, first of all, it is topographically connected to what ganglion? Ciliary ganglion. There is a ciliary ganglion is also present lateral to the optic nerve. That's ciliary ganglion. Second thing we said, this nerve will give off two branches. One is posterior ethmoidal. It will give off what? Anterior ethmoidal. And then finally it will come out as what now? It will come out as the infratrochlear nerve. Let me name this for you. This nerve here is the nasociliary nerve, which you can see is crossing the optic nerve from above and going from lateral to medial side. Connected to what ganglion? Ciliary ganglion. Please understand this point here, guys. From this nasociliary nerve, we have other branches also, which has to reach, basically have to reach the eyeball. Eyeball में हमें कुछ muscle supply करनी है, sphincter pupillae, ciliaris and all that. Ciliary ganglion is responsible for that. We discussed that. Ciliary ganglion, what do you say, Edinger-Westphal nucleus is the one which is to supply the sphincter pupillae and ciliaris. Actually, from the ciliary ganglion, I'll tell you, there are some nerves which will come out here and will go directly and pierces the eyeball from the posterior side. These nerves are shorter in length. That's why all these nerves are called as short ciliary nerves. So you can say short ciliary nerves are the branches of ciliary ganglion. These are not the branches of nasociliary nerve. They are the branches of ciliary ganglion. ये ciliary ganglion की branches हैं. Although when you see the lateral side, more toward the lateral side, you have some nerve which are directly going inside the eyeball. These nerves have to travel a longer distance. So what nerves are these? These are long ciliary nerves. Let me just write them separately, otherwise it will be confusing, guys. Those nerves over there are long ciliary nerves. What I'm trying to tell you here is that short ciliary nerves and long ciliary nerves are actually the branch of nasociliary. Short ciliary nerves are the branches of ciliary ganglion. That ganglion is ciliary ganglion, right? They are the branches of ciliary ganglion. This nerve here is what? That is a posterior ethmoidal nerve. I'll tell you the function. This nerve here is the anterior ethmoidal nerve. And then finally we said it will come out as what? This will come out as an infratrochlear nerve. That will come out as infratrochlear nerve. So this is, I'm just highlighting the contribution of nasociliary. That's nasociliary nerve, which is topographically connected to ciliary ganglion. It gives off the long ciliary nerves, which is lateral to the optic nerve, most of them. We have posterior ethmoidal, we have anterior ethmoidal, and we have then infratrochlear nerve, which ultimately comes out. Clear, guys? Is that clear? Now the question here is that what exactly is the function of lacrimal nerve? Is supplying the lacrimal gland, and it is supplying the skin also. It is come outing and supplying the skin of the upper eyelid. What is the supratrochlear, supraorbital nerve? We all know it is going to supply the skin of the scalp. We know that. What is ethmoidal nerve doing? What are these anterior ethmoidal and posterior ethmoidal nerve doing? Well, both these anterior and posterior ethmoidal nerve, the function basically is, just 1 second. The function of the posterior and the ethmoidal nerve are, posterior ethmoidal nerve is behind, so it is going to supply the ethmoidal air sinuses, and the other air sinus which is in close relation is the sphenoidal air sinus. इसको लिख लेते हैं पहले, and then we'll understand it better. The posterior ethmoidal nerve, it supplies the ethmoidal and sphenoidal air sinus. Sphenoidal air. But ethmoidal air sinus can be seen in the ethmoid bone, that is on the medial wall of the orbit. If you look at this here, let me show you the picture. You can see ethmoidal air sinuses in this. This is slightly broken, and thankfully it is broken. You can see on the medial wall. Can you see those sinuses over there, beta? On the medial wall of the orbit. On the medial wall of the orbit, you can see some sinuses present there, and those sinuses are the ethmoidal air sinuses. And there is another sinus which is present somewhere here inside, that is called as a sphenoidal. So it is going to supply both ethmoidal as well as a sphenoidal air sinus. It is going to supply both ethmoidal and sphenoidal air sinus. That is anterior ethmoidal nerve की अपनी कहानी यार. Anterior ethmoidal nerve कह रहा है कि मैं तो कुछ और ही करूंगा. Anterior ethmoidal nerve, first it goes into the cranial cavity, and then it comes into the nasal cavity. Abhi how it goes into cranial cavity, how it comes to nasal cavity, that is not important for now. Anterior ethmoidal nerve, it goes into the, if a nerve goes into the cranial cavity, what will it supply there? It will supply the cranial dura mater. It will supply the dura mater. And then this anterior ethmoidal nerve, after supplying the dura mater in the cranial fossa, in the anterior cranial fossa, it will come down into the nasal cavity. It will come down to the nasal cavity. So it will supply the nasal mucosa. It supplies nasal mucosa. और फिर भी वहां पे कहानी खत्म नहीं हुई. This anterior ethmoidal nerve ultimately comes out just below the nasal bone. That's a nasal bone. This is a nasal cartilage. So it will just come out below the nasal bone outside, and it will come out as the nerve called as the external nasal nerve. It will come out as the external nasal nerve to obviously supply the skin of the root of the nose, skin of the tip of the nose. It will come down here and will supply the skin here at the tip of the nose. I will show you everything on the picture, but just understand this once again. Beta, frontal nerve or lacrimal nerve में कोई confusion नहीं. That's everyone understands that. Frontal nerve dividing into two branches, supratrochlear, supraorbital, supplying the skin of forehead and the scalp. Fine, done. Lacrimal nerve supplying the lacrimal gland and ultimately comes out to supply the skin of the upper eyelid on the outer side, on the lateral side. वो भी done, no problem. Nasociliary आपको समझना है. Nasociliary nerve, first of all, as you can see in the course, it first passes superior from lateral to medial side above the optic nerve, goes toward the medial side. This gives a connecting branch to the ciliary ganglion. The topographic connection is ciliary ganglion के साथ. It gives off direct branches which are called as what nerve? These are called as the long ciliary nerves. These are called as the long ciliary nerves. Long ciliary nerve. अच्छा, long ciliary nerve का function क्या actually? The function of long ciliary nerve is basically it is carrying the sensory fiber from ciliary body, iris and the cornea. Iris से, cornea से, and ciliary body sensory. Long ciliary nerve, it is carrying the sensation from, they are carrying sensation from cornea, from ciliary body and iris. That's the function of long ciliary nerve, and you do not bother about the short ciliary nerve क्योंकि उनकी कहानी अलग है. Short ciliary nerves are basically branches of ciliary ganglion. Short ciliary nerves are the branches of ciliary ganglion. उनका काम अलग है. We should not consider that as a function of this nasociliary nerve. So nasociliary में से you should only think of long ciliary nerves which are going to carry the sensation from the cornea, ciliary body, and iris. Right? We will this again will be discussed when we'll talk about the orbit. The nerve comes to the medial side, gives off posterior ethmoidal. But a posterior ethmoidal nerve just supply the ethmoidal air sinus and the sphenoidal air sinus. Anterior ethmoidal sinus is more it is having a longer course. Anterior ethmoidal nerve goes into the cranial cavity and supply the dura mater of the anterior cranial fossa. Then from there only it will go downward and come into nasal cavity. It supplies the nasal mucosa, and finally come out as an external nasal nerve here to supply the skin at the tip of the nose. If you are able to understand this picture here, first let me show you a comparative image, and then I'll show you one more image to see to make you understand what exactly the nerve is doing. Well, जो आपने बेटा अभी draw किया है, देखो यहाँ से शुरू करते हैं. I try to draw exactly on this function. As soon as you open the roof of the orbit, जैसे आपने roof हटाया orbit का, जैसे आपने roof हटाया यहाँ पे, तो first thing that you'll see is this branch here, and that is the frontal nerve. We did not discuss frontal nerve because frontal nerve के लिए हमें nerve muscle हटानी पड़ती है. That's a frontal nerve. And we said frontal nerve, we already know frontal nerve goes in front and divides into which two branches? The supratrochlear and supraorbital. Look at this. This one here is the supratrochlear nerve, and this one here is the supraorbital nerve. The medial one is supratrochlear, the lateral one is supraorbital. The thicker one is supraorbital, which is going all the way. Right? You can also see the lacrimal nerve. In this picture only, I can also see the lacrimal nerve running along the lateral wall, and it is supplying the lacrimal gland. So even lacrimal nerve can be seen here. Forget about these guys. That's a trochlear nerve and all. Unko bhi consider nahi karte. Just don't think about that nerve for now. That's a different nerve. So I wanted to just focus on the frontal nerve and lacrimal nerve in this picture. Now, if you want to see the nasociliary nerve, what you will do? Aapko beta muscle hatani padenge. You have to remove the frontal nerve. You have to this muscle which is called as LPS. You have to remove this muscle which is called as superior rectus. If you remove all these muscles from here, then only I will be seeing the nasociliary nerve, which will go like this, in that manner. If you understood this, let me remove these three things, this one, and this one, and see how this will look like. There you go. Can you see? It's a cut section of both. दोनों muscle cut कर दिया हमने, nerve भी हटा दिया हमें. Now I hope now you can appreciate this nerve beta. This once again lacrimal nerve can be seen here, but I wanted to focus on nasociliary. This nerve here, the one which I'm pointing at, that is a nasociliary nerve. Now you can see nasociliary nerve is showing a connection to the ganglion. That is what? To what ganglion? To the ciliary ganglion. And then you see ciliary ganglion se jo nerve nikal ke aa rahi hai. What nerves are those? Those are the short ciliary nerves. I will label everything and then send it to you. Yeah. Then you see more lately, you have some nerve which are directly going into the eyeball. Those are what nerve? Those are long ciliary nerves. Beta, they are long ciliary nerves, and these are the branches. Long ciliary nerves are the branches of the nasociliary nerve as such. And what is the function of long ciliary nerve? As we said, from the ciliary body, from cornea, from the iris, ये sensation लेकर आती है वहाँ से. If you touch your cornea, that sensation that you feel आपको जो touch होने की, वो इसी nerve की वजह से, long ciliary nerve की वजह से. Then you can see the nerve is running toward the medial side. What nerve is that, beta? That nerve is what? Posterior ethmoidal nerve. This one is posterior ethmoidal. And this nerve here is the anterior ethmoidal nerve. And ultimately nasociliary nerve, you can see it is going out also. It will go out as well. And ultimately will come out as what nerve? As the infratrochlear nerve to supply the skin. This is how you will be able to see the three nerve. आपके लिए ये important नहीं है खाली कि just to know the three branches. As a first year student, guys, you should know that if you, I mean, obviously you will be having a dissection viva also, then how will you identify it? If the entire orbit is intact, the nerve that you see on the topmost close to the roof is frontal nerve. You remove the frontal nerve, you remove two muscles from there, and then you are able to see the nasociliary nerve. Lacrimal nerve is on the side, you can see. So basically you are expecting to see the nasociliary is running from lateral to medial side. So mainly on the medial side, lacrimal on the lateral side, and frontal nerve is on the roof here. How about if we compare them in this picture now? What? Chalo. It's a different view, but I want you to be able to identify them in every single view, guys. What nerve is this? Beta, what nerve is that? That is the frontal nerve. Look at this. That is a frontal nerve. And clearly this is a frontal nerve. It is dividing into two branches. We have this nerve and this one here. That's a supratrochlear nerve. And this one here is the, that's a supraorbital nerve. The medial one is supratrochlear and the lateral one is supraorbital. Clear? Next chalte beta. Next nerve. Look at this. That is this is the lacrimal nerve, which are lateral wall pe nerve hai. So this is the lacrimal nerve. Let me just mark it here only. That is the lacrimal nerve. And I hope you can notice that lacrimal nerve is not only supplying the lacrimal gland. Can you see this branch coming out here? That's a branch of the lacrimal nerve coming out, which is going to supply the skin on the lateral side of the upper eyelid. Most important, the nasociliary. There we have it. That is nasociliary nerve. Nasociliary nerve is topographically connected to what? Ciliary ganglion. Now you can see directly branch coming from ciliary ganglion. What nerves are these? These are short ciliary nerves. Eyeball is not shown here, so it is more easy. And then you get some direct branches which are coming from nasociliary. These are long ciliary nerve. Then you can see the nerve is turning toward the medial side. What nerve is that? That is posterior ethmoidal. What nerve is that? That is anterior ethmoidal. And after that, you can see the nerve is continuing and coming out, and that nerve is an infratrochlear nerve. Makes sense, guys. Supratrochlear nerve ऊपर जा रहा बेटा, infratrochlear nerve नीचे जा रहा. That is supratrochlear, that is infratrochlear. That must be supplying the skin of the forehead. This must be supplying the skin of the root of the nose here. Don't bother about these connections and all this हम discuss करेंगे बाद में. Is that understood? Is the ophthalmic nerve understood to you guys? The frontal, the nasociliary, the lacrimal nerve, their course, and how they are going to reach their target structures. How they're going to reach the target structure. We have to understand the maxillary also, and then we will compare the two also. Chalo, from here, let us take our focus to the next nerve, and that is the maxillary nerve. Let's talk about the maxillary nerve. और फिर वापस आएंगे हम इस picture के ऊपर to understand the maxillary nerve here and how maxillary nerve is connected to this also. But how about if I look at this picture here first, and we look at this image here and first try to understand the maxillary nerve on this image, और उसके बाद draw करते हैं बेटा. देखो, maxillary nerve, what you'll see, this maxillary nerve is going out of the foramen, and we said what foramen is that? That is foramen rotundum. Before we draw the schematic diagram, it's better to understand it here. Once it goes out of the foramen rotundum, can you see it is reaching this fossa here? Now, below zygomatic bone, below zygomatic bone, this fossa here is called as the infratemporal fossa. That is a temporal fossa. Below zygomatic arch, this is called as the infratemporal fossa. This whole thing is an infratemporal fossa. This whole thing is an infratemporal fossa. But what you see, what bone is that? That is a maxilla bone. And beta, this plate here is called as a lateral pterygoid plate. It's a part of sphenoid bone. We call it lateral pterygoid plate. Lateral pterygoid plate and maxilla. So pterygoid plate and maxilla. So between pterygoid plate and maxilla, we have a fissure here. That is called as a pterygomaxillary fissure. Now listen to this word. Pterygomaxillary fissure. Pterygomaxillary fissure. But if I keep going upward, I will go into a fossa there. Now there is a depression which is present here on the side, and that fossa is called as a pterygo. That's because of this bone, pterygopalatine fossa. अंदर की तरफ जो bone होगी, palatine bone का part होता है अंदर. So that's a fossa present between the pterygoid bone and the palatine bone. So we call it pterygopalatine fossa. This fissure is what? Pterygomaxillary fissure. The fossa inside is what? Pterygopalatine fossa. Let me see if I have a picture to. No, I don't. Okay. चलो कोई बात नहीं, अभी फिलहाल के लिए याद रखते हैं. So that fossa over there is what fossa? That is a pterygopalatine fossa. So beta, maxillary nerve comes into the pterygopalatine fossa, and what you see, pterygopalatine fossa में maxillary nerve is topographically connected to another ganglion here, and that is a pterygopalatine ganglion. नाम ही क्या है? Fossa कौन सा है? Pterygopalatine fossa. तो ganglion भी कौन सा हुआ? Pterygopalatine ganglion. So maxillary nerve is topographically connected to pterygopalatine ganglion. जो मैं बता रहा हूँ सिर्फ वो देखो, फालतू की ब्रांचेस पर ध्यान नहीं देना अभी. We will discuss all the branches here. So we discussed that's a maxillary nerve coming in here. We saw it till here. Okay. Then what you see here, that let's focus to this. So maxillary nerve is connected to this ganglion, pterygopalatine ganglion. अभी उसके बाद क्या है? Maxillary nerve has to cover the distance and it has to run in the floor of the orbit. बेटा. This here is the maxilla bone, and this sinus obviously is a maxillary sinus, right? That's a maxillary sinus. We all know that we have a sinus in the maxilla bone. So this nerve is running in the roof of the maxilla. You can say it is running in the roof of maxilla, or in other words, you can say it is running in the floor of the orbit. बेटा, orbit का floor और maxilla का roof एक ही बात है ना? So this nerve is running basically in the floor of the orbit. So we call it maxillary nerve, maxillary nerve, maxillary nerve till here. But after this point, we start calling it infraorbital nerve because it is running below the orbit. ये सब orbit के content है. This nerve runs below the orbit, so we start calling it what? Infraorbital nerve. And that is the same name it will come out on the face also. Orbit के नीचे बाहर निकल के आती है as what nerve? As infraorbital nerve only. It comes out as infraorbital nerve. But what is it has done inside? The three branches. Look at these three branches, important branches. One branch which will come from maxillary nerve is going to enter into the maxilla and supplying the maxillary sinus and teeth and gums. Then we have two branches here, one coming from the infraorbital nerve, and they are also doing the same function. This is, guys, this is 1, this is 2, and this is 3. So overall, you're looking at 3 branches which are coming down, and they are supplying the maxillary sinus. They are not only supplying the maxillary sinus, they are supplying the upper gums and teeth. and that's why we call them superior alveolar nerve. Superior matlab upar wala, not below, upper. Superior alveolar is for the alveoli, for the gums. Superior alveolar nerve. 1, 2, and 3. There are 3 superior alveolar nerve. One is posterior, one is middle, one is anterior. I'll come back to this picture. Let me just first put it in a schematic diagram so that you will understand it better. Guys, come back to that same diagram here, and this time what we're going to do is, let's draw the maxillary nerve below in here. So what we said, that maxillary nerve will come out. Maxillary nerve, first of all, it will leave the orbit through which foramen? That is the foramen rotundum. Let us say here is the foramen rotundum. I'm writing it in short, guys. That is foramen rotundum, and that's a maxillary nerve we are talking about. Maxillary nerve coming out of FR. Just keep writing this full form somewhere. There is foramen rotundum. Once it comes out of foramen rotundum, it comes into which fossa? Pterygopalatine fossa. Let's not draw it. Kyun confusion create kiya? So there is somewhere we have here pterygopalatine fossa, and in the pterygopalatine fossa, this nerve is topographically connected to our ganglion. That is what? Pterygopalatine ganglion. It is topographically connected to this pterygopalatine ganglion. Ciliary ganglion was connected to nasociliary nerve. Pterygopalatine ganglion is connected to maxillary nerve. And this is what we said in the beginning, that all parasympathetic ganglion are topographically connected to trigeminal nerve. दो तो आपके सामने आए गए, बाकी दो mandibular nerve में. So pterygopalatine ganglion. अच्छा, after this, we said the nerve is going to enter in the floor of the orbit, or you can say in the roof of the maxilla. So let me, मैं यहाँ पे maxilla bone draw कर लेता हूँ. Let's say this is the maxilla here. Let's keep it very simple. कुछ fancy draw करने की जरूरत नहीं. That's a maxilla here. And let us say these are all maxillary teeth. Just for the reference, guys. That's maxilla and maxillary teeth you're looking at. So nerve is running in the floor of the orbit here. And ultimately, it will come out of a foramen, which is called as the infraorbital foramen, and supply the skin on the face. Well, infraorbital nerve is not only this. Infraorbital nerve is this entire thing. ये जरूर ध्यान रखना कि पूरी infraorbital nerve है, because it is running in the floor of the orbit. So this whole nerve is infraorbital nerve. That is infraorbital nerve. Up to clear, guys. Foramen rotundum. It came out of foramen rotundum, the maxillary nerve. It is topographically connected to pterygopalatine ganglion. It runs as infraorbital nerve. Let me highlight that infraorbital nerve, which is running in the floor of the orbit. And 3 branches that we said here is one which will start outside the maxilla, like this, and will enter into the maxilla by piercing the body of maxilla. And the 2 branches are given off inside only. We said all these 3 branches are supplying the maxillary sinus. We have obviously maxillary sinus is there. So they are all supplying the maxillary sinus undoubtedly. Apart from that, they're also supplying the alveoli. And because they're coming from above, so we call them superior alveolar nerve. Look at this, guys. This one, and this one, they're all what nerve? Superior alveolar nerve, superior alveolar nerve, superior alveolar nerve. But this one is present on the posterior side, so we call it posterior superior alveolar. This is middle superior alveolar, and that is anterior superior alveolar nerve. Posterior superior, middle superior, and anterior superior alveolar nerve. Make sure you write the whole thing. Posterior superior alveolar nerve, middle superior alveolar nerve, and anterior superior alveolar nerve. Anterior superior alveolar nerve. That's all we need to know about the maxillary. So maxillary nerve basically is supplying the maxillary air sinus. You can say it is supplying the maxillary air sinus. It is coming out to supply the skin also. Infraorbital nerve is supplying the skin. Okay. And then we see the 3 superior alveolar nerve, posterior, middle, and anterior superior alveolar nerve. And if I go with that, again, guys, which nerve is coming out? Infraorbital nerve is coming out. So again, you will see it on the face. Till now, we have already collected how many nerves they go? 1, 2, 3, 4, and 5. We already saw 5 nerves are coming out: supratrochlear, supraorbital, infratrochlear, lacrimal nerve, and infraorbital nerve also coming out to supply the skin of the face. This is about the maxillary nerve. एक छोटा सा connection which I have to tell you here about the maxillary nerve and lacrimal nerve. See, the connection. There is a nerve which is connecting the maxillary nerve and the lacrimal nerve. There is a connection between the two. Let me show you that connection first in the picture, and then I'm gonna draw it for you so that आपको याद रहे, because that connection is very, very important, guys. Let me just get rid of all these labelings, you know it, and just focus on the labeling which I'm gonna do it for you guys. Now, can you see a branch coming from the maxillary nerve here? Beta, this nerve is called as zygomatic nerve. Pehle suno usko. That's called as zygomatic branch or zygomatic nerve. This zygomatic nerve is having two divisions. One is called as zygomaticofacial, which will come from the maxillary bone and will come from the zygomatic bone and come onto the face and supply the skin. Again, another nerve. That nerve is what? That is zygomaticofacial nerve. Zygomaticofacial nerve. And then there is a branch which is called as zygomaticotemporal nerve. One will be actually supplying the skin more in the front, that is zygomaticofacial, and one will be supplying the skin more on the side, so zygomaticotemporal. Dono skin, face की skin को supply कर रहे हैं, just because of the direction is one is toward the face and one is toward the temporal region, so zygomaticofacial, zygomaticotemporal. But the thing here is, can you see a branch of zygomaticotemporal connecting to what? Lacrimal nerve. There is a branch of zygomaticotemporal nerve which is connecting it to the lacrimal nerve. अब उस ब्रांच का, उस कनेक्शन का लॉजिक क्या है, वो लॉजिक हम थोड़ा देर में समझेंगे इन द फेशियल नर्व. बट यू हैव टू रिमेंबर दैट देयर इज अ कनेक्शन ऑफ द मैक्सिलरी नर्व दैट इज कॉल्ड एज zygomatic nerve. We have zygomaticotemporal, zygomaticofacial, and then we have this connecting link which is connecting it to the lacrimal nerve. चलो मैं आपको लॉजिक बता देता हूँ. I'll tell you what is the logic here, guys, and then you will find it more interesting. Guys, we said that parasympathetic nerves, they never go beyond their ganglion. Now, what is that ganglion? There is a pterygopalatal ganglion. Guys, pterygopalatal ganglion, the nerve which is topographically connected to pterygopalatal ganglion is maxillary nerve. But functional nerve तो कोई दूसरा होगा ना. I'll tell you what is the functional nerve. Facial nerve is the functional for this. Now, from somewhere, अभी facial nerve discuss नहीं किया बेटा हमने. Facial nerve की कोई branch आएगी जो यहाँ पे आके relay करेगी. A branch of facial nerve will come and relay here. What branch is that? Just don't worry about it. भूल जाओ उसको भी. But facial nerve will, a branch of facial nerve will come into the pterygopalatal ganglion and will end there. But that is not the solution. We have to supply the lacrimal gland. So this is what is happening here. From this ganglion, post-ganglionic fibers will go through the maxillary nerve, then will go through the zygomaticotemporal nerve, then will go to zygomatic nerve and zygomaticotemporal nerve. Then they will use this lacrimal nerve and join with what nerve? Lacrimal nerve, and that's how they're going to reach what gland? That is how the lacrimal gland is supplied. Imagine, if we don't know about all these nerves, lacrimal gland innervation is so complicated. Facial nerve will come and relay, a branch of facial nerve I should say, a branch of facial nerve beta will come and relay into the pterygopalatal ganglion. That we will discuss today only. That is our today's part. From the ganglion to the gland, it cannot be done by the facial nerve. It has to be the topographic nerve. Topographic nerve is what? Trigeminal nerve. So see, from the maxillary to the zygomatic nerve, from the zygomatic nerve to zygomaticotemporal, from zygomaticotemporal a connecting branch which takes it to the lacrimal, and then that is how you're going to reach the lacrimal gland. Sir, two parts are done. One connection we said, what is the connection here? I don't want to, that connection which is present here from here to the lacrimal nerve, let me not draw it here, थोड़ा confusing हो जाएगा. या एक काम करते हैं, एक छोटा सा connection draw कर लेते हैं यहाँ पे. Let us draw a connection, but let's not write anything about it. Let's just draw a connection like this, a very small connection. Try to use a different color, and I'm going to write it separately for you, that what connection is that. So that is a maxillary nerve. This is a pterygopalatal ganglion. So we said from the maxillary nerve, a branch will come out that is called as zygomatic nerve. Zygomatic nerve. But a zygomatic nerve divides into two branches. One is zygomaticofacial and zygomaticotemporal. That is zygomaticofacial nerve, zygomaticotemporal nerve, right? Zygomaticofacial, zygomaticotemporal. And then finally we said a branch from zygomaticotemporal is going to join the lacrimal nerve to supply the lacrimal gland. That is a lacrimal nerve, and this is the connecting branch here. So basically our purpose here is to see that how the post-ganglionic fiber will go. They will go through the zygomatic nerve, then zygomaticotemporal nerve, then through this connecting branch, and then finally through the lacrimal nerve to reach the lacrimal gland. Coming to the third part of the trigeminal, that is mandibular nerve. Now, if I remind you something from this diagram, again, don't have to draw this, guys. If I remind you from this diagram, we said the mandibular nerve, this is the only sensory root we have. Don't do anything in the diagram. That's a sensory root. And we have a motor root also, which is coming from here. And then they both will join at the level of the foramen ovale. So let's start from there. I again request you to take a fresh page for this because we have to go quite long in this. काफी सारी branches हैं mandibular nerve की, so guys don't try to save on pages. Make sure to start from the top of the page. So here we have the once again, that's a Meckel's cave. That's a Meckel's cave. Don't have to draw it very big here. And here is the trigeminal ganglion or Gazarian's ganglion. Three-part ophthalmic, maxillary, mandibular. We will be focusing on mandibular this time. And let's presume this is where we have foramen. That's foramen ovale. And just behind the foramen ovale, just posterior to foramen ovale, there is a foramen called as foramen spinosum. That's foramen ovale. And in fact, I should draw it ovale in front. If I go technically correct here, that is a foramen ovale here. And then behind foramen ovale, that is foramen spinosum. Let's say this is the anterior of this, and that's a posterior side. Mandibular nerve, this is foramen ovale. And here we have spinosum, foramen spinosum. Guys, mandibular nerve, as I said, we have a motor and the sensory part. So this is a sensory division, which is a thicker one actually. That's a sensory part of mandibular nerve, which will go out of the foramen ovale or reach the foramen ovale. And then we have the sensory part also, a motor part also, I'm sorry. That's a motor part which will come separately and then we'll keep running with this sensory part. And this motor part will join the nerve at the level of foramen ovale only. So then they become a single nerve only. Obviously, it is having a motor and sensory component, both are there. But this here is the sensory root of the mandibular nerve, and let's say this is the motor root of mandibular nerve, right? Once they meet at the level of foramen ovale, they like form a single trunk only. Foramen ovale giving passage to the many other structures, but mandibular nerve is one main thing which is going through it. Now this nerve, when it forms a single trunk like this, that let us say this is a trunk of the mandibular nerve. Although itna bada nahi hota trunk, but just to show you guys, that's a trunk of the mandibular nerve. And then after the trunk, it is going to divide into the anterior and posterior division. But the trunk is very, very important here to discuss. Guys, there are four important things about the trunk, and all four are extremely important. Like point number one, that there is a branch which will be given off from the trunk of mandibular nerve, which will go back into the cranial cavity, and that will go back into the cranial cavity through the foramen spinosum. So as soon as the nerve comes out, it gives off a branch which goes back into the cranial cavity. And because it is going back into the cranial cavity, so either you call it the recurrent branch of mandibular nerve, recurrent, or you can call it the nervus spinosus. It is going from foramen spinosum, so we can call it nervus spinosus also. I'm going to write about this nerve separately here. That nerve over there, which I put an asterisk mark here, that is called as the nervus spinosus, guys. Nervus spinosus, or you can say recurrent branch of mandibular nerve. Any nerve which goes back into cranial cavity, whatever, whether it's a branch of maxillary nerve or mandibular nerve or any nerve, the only purpose to go back into the cranial cavity is to supply the dura mater. So this nerve is supplying the dura. It is supplying the dura of middle cranial fossa. Nervus spinosus is mainly supplying the dura of the middle cranial fossa. It's a dominant nerve of the dura mater. It is supplying the dura mater. So we call it the nervus spinosus. There is an artery also going through this foramen called as a middle meningeal artery, but I'm going to draw that middle meningeal artery in a while because I have to share one important relation here, guys. So that's one thing about the trunk. It gives a what nerve? Nervus spinosus. The second important thing about the trunk is that the otic ganglion is present on the medial side of the trunk. If you can draw it that way, guys, this is the otic ganglion. Usually are not able to see the otic ganglion because it is on the medial side of the nerve. So that ganglion here is the otic ganglion. That is the otic ganglion. I write it in short only. That is OG. I'm writing here, guys. OG, please write it somewhere separately. That is otic ganglion. That's the second important thing, that on the medial side of the trunk, we have otic ganglion. Whatever I'm discussing, I'll try to show everything in the image also. The trunk of the mandibular nerve, this trunk of the mandibular nerve, it supplies just one muscle of mastication. There are four muscles of mastication. I don't know if you know the name for those muscles as of now. Guys, there are four muscles of mastication. One is temporalis, one is masseter, one is medial pterygoid, and one is lateral pterygoid. There are 4 muscles. If you don't know the name, doesn't matter. Out of the 4 muscle, only one muscle is supplied by the trunk, and that muscle is the medial pterygoid. That muscle is the medial pterygoid. 3 बातें होगी. Nervous spinosus, otic ganglion connection, and the one muscle of mastication. Out of the 4 muscle, one is supplied by the trunk. That is the nerve to what muscle? Medial pterygoid. Fourth and the last important thing, that the trunk के बारे में, the nerve which supplies medial pterygoid, it is going to supply the 2 muscles with the name of tensor. We have a muscle called as a tensor veli palatini and tensor tympani, guys. TVP and TTF. Just writing it separately for you again. TVP. TVP stands for tensor veli palatini. Tensor veli palatini. It is actually one of the muscle of the palate. It tenses the palate. So the name is tensor veli palatini. And another muscle with the name tensor is tensor tympani. As the name suggests, tympani. It is in the middle ear. So this tensor tympani muscle is basically stretching or producing the tension in the tympanic membrane, into eardrum. Tensor veli palatini and tensor tympani. 2 ही muscle है जिनके नाम में tensor आता है. Tensor veli palatini, tensor tympani, and they both are supplied by the same nerve which supplies what? Medial pterygoid. Nerve to medial pterygoid supplies tensor veli palatini and tensor tympani. Is that clear till here? Tensor veli palatini, tensor tympani. So this is about what? This is about the trunk of the mandibular nerve. 4 important things about the trunk. All 4 are important. Nervous spinosus, supplying the dura mater of middle cranial fossa. On the medial side, it is connected to the otic ganglion, topographic connection. We said all 4 ganglions are to the trigeminal nerve. We already saw ciliary, we already saw pterygopalatine, and now you're looking at otic ganglion. उसके बाद एक और रहता है अभी. Number 3, the trunk gives supply to only one muscle of mastication, that is medial pterygoid. Out of the 4, one muscle is supplied here, that is medial pterygoid. And the same nerve which supplies medial pterygoid also supplies the 2 tensor muscle. एक बेटा palate में होती है muscle और एक middle ear के अंदर tensor veli palatini, tensor tympani. After that, the mandibular nerve is going to divide into the anterior and posterior division. Now, this here, let us say, is the anterior division, and here we have the posterior division. Now, when you look at anterior division, the branches coming from the anterior division, let me just take one by one, guys. This is AD, and let's say this is PD, anterior and posterior division. The main purpose of anterior division is to supply the remaining muscles of mastication. So you will have 3 branches coming from here, from the anterior division, जिनका काम है सिर्फ muscle of mastication supply करना. Which muscle? What are the muscles left? It must be supplying the muscle with the name of lateral pterygoid. Lateral pterygoid. It is supplying the muscle that is temporalis muscle. We call them deep temporal branches. Muscle is actually temporalis. And it also supplies what muscle? Masseter muscle. We will be discussing all these muscles and everything in detail. अभी next 1 week में हमारी बहुत सारी classes हैं. Lateral pterygoid, temporalis, and masseter, guys. So that means this here is a motor branch. This also is a motor branch, and this also is a motor branch. They're supplying the muscles. But there is one sensory branch which will come from the anterior division. That's important also, guys. There is, how about if I use a different color to denote that? There is one sensory branch which will come from the anterior division, and that branch or that nerve is called as the buccal nerve. That branch is called as a buccal nerve, and this is a sensory branch. Now, please don't confuse this buccal nerve with the buccal branch of facial nerve. No. We said we have 5 branches of facial nerve, which we will discuss again. One of them was buccal nerve, guys. Remember? Temporal, zygomatic, buccal. That was a buccal branch of facial. वो motor branch है. This is a buccal branch of mandibular. It's a sensory branch. And what exactly this buccal branch is doing? This buccal branch of mandibular nerve, this buccal branch is supplying the skin of the cheek. It supplies the skin of the cheek here. Buccal means cheek only. And it is also supplying the mucosa of the cheek. Imagine mucosa is inside and skin is outside. So it is supplying the skin and the mucosa. And in doing so, this buccal nerve also pierces the muscle here called as buccinator muscle. Buccinator is a muscle of facial expression, guys. Buccinator is a muscle of facial expression. So this nerve, it supplies the mucosa, it supplies the skin, and obviously doing that, it also has to pierce the buccinator muscle also. As a general rule in anatomy, if any nerve pierces a muscle or goes through it, it supplies it also. Like if you remember some examples from upper limb, guys, coracobrachialis was pierced by the musculocutaneous nerve. It supplies it also. Pronator teres was having median nerve in between. It supplies it also. Flexor carpi ulnaris, ulnar nerve was there. It's supplying it also. So same, that's how it is there. But there are some examples, there are some exceptions where the muscle will be pierced by a nerve, but still it will not supply it. And this is that exception here. So what buccal nerve is doing, which I will show you in the image also in a while, buccal nerve, just make a note there that it pierces buccinator. It pierces buccinator, but doesn't supply it. It pierces buccinator, but doesn't supply it. That's one important point to remember from buccal nerve. So what buccal nerve is supplying? It is basically supplying the skin and mucosa of cheek. That's what the function is. It is supplying the skin and the mucosa of the cheek, the buccal nerve. It is piercing the buccinator because it has to come out to supply, but it is not going to supply the buccinator muscle. Buccinator beta is a muscle of facial expression, and muscle of facial expression is supplied by the facial nerve. So buccinator is supplied by the buccal branch of facial nerve, not by the buccal branch of mandibular nerve. Just be careful. That's a buccal branch of facial nerve. जो हम discuss करेंगे. Is that clear? Trunk, 4 important things we saw. Anterior division giving off 4 branches. Out of 3 branches are just to supply the muscles of mastication, and then we have a buccal nerve which is piercing the buccinator, doesn't supply it, but the supply is to the skin and the mucosa of the cheek region. Abhi coming to the posterior division, which is very, very, very important, guys. Posterior division gives off 3 branches, and I'll take them one by one. One of the branch of the posterior division is called as auriculotemporal nerve. Now look at this, how I'm drawing it, guys. Look at this, the way I'm drawing it. That's one of the branch from posterior division. इसके अलावा और भी हैं. अभी पहले let's stick to this one. This nerve here is called as the auriculotemporal nerve. That is called as auriculotemporal nerve. I hope you remember auriculotemporal nerve we discussed in the scalp also. The nerve which was supplying the the scalp, skin of the scalp, that is auriculotemporal nerve. So as the name suggests, auriculotemporal nerve is going to supply the skin of the temple region. Here in the scalp region, it will supply the skin of the temple region. It will supply the skin of the upper 2/3 of the auricle also. Auriculotemporal nerve also supplies the temporomandibular joint, and it also supplies parotid gland. देखो कैसे याद रखो guys. Put your hand here. Just keep your hand on the side here. Everything that is under your palm here is all supplied by the auriculotemporal nerve. Auricle, it is covering the auricle, so it is supplying the upper 2/3 of auricle. I'll write that for you. Then what? It is supplying the skin of the temple region. It supplies the skin of the scalp here. It supplies the skin of the temple region. What else? What joint is here? The temporomandibular joint is also supplied by this. And what is the gland in this region? That is parotid gland. So they're all supplied by this auriculotemporal nerve. It will be better if you write about this auriculotemporal nerve separately somewhere. If you don't have space on the side, you can just write it somewhere, guys. Auriculotemporal nerve, it supplies the skin of the, let me write precisely, skin of upper 2/3. Upper 2/3 of auricle, that is one. It is supplying the skin of the upper 2/3 of auricle. Number 2, it supplies the skin of the temple region. So it supplies temple region, or you can say the skin of the temple region. It supplies temporomandibular joint, TMJ. It supplies TMJ, and it also supplies the parotid gland. Parotid gland. This is all done by the very, very important nerve, the auriculotemporal nerve. You will be able to understand auriculotemporal nerve even better when we'll talk about the parotid gland actually. So that's the auriculotemporal nerve, supplies skin under upper 2/3 of auricle, temple region, temporomandibular joint also, and the parotid gland. Now the reason I asked you to draw this nerve in such a way, guys, auriculotemporal nerve, because when this nerve goes back, actually it's a very short nerve. When this nerve goes back here from this infratemporal fossa, it runs backward, it makes a loop around the artery, and that artery is a middle meningeal artery. Middle meningeal artery, that's how you identify it. Is fossa ke andar, if you want to identify the auriculotemporal nerve, that is the way, guys. It is looping around the middle meningeal artery. Look at this, guys. Middle meningeal artery is the main artery which supplies the dura mater of the cranial fossa. What nerve was that? That was nervus spinosus. And same foramen spinosum is also giving passage to middle meningeal artery. Just make sure you draw it this way, that this middle meningeal artery is basically looped by, that is the MMA, middle meningeal artery, the main artery which supplies the meninges. So this middle meningeal artery, it is looped by the auriculotemporal. That is how you identify the nerve also. It is looping around the middle meningeal artery, right? Middle meningeal artery. That was one division, guys, auriculotemporal. There are three branches from posterior division. One is auriculotemporal. The next is lingual. So Ali, it's like Ali branches, A-L-I, Ali branches. Acha, lingual nerve, and then we have a branch which is going to the mandible, that is called as a inferior alveolar nerve. It is better if I draw something for you here to show those two branches, guys. Imagine if this here is the mandible. Let me just try to put it this way. But this here is the mandible. And just for the sake of convenience, let's say I have cut the mandible. I have cut the mandible from here. Just cut the mandible. Mandible mein there is a foramen which is present on the outer aspect here. Norma frontalis mein dekha bhi tha. That is called as mental foramen. That is a mental foramen. And there is a canal which is running through. There is a canal which is running. This is mandible. So if I just put this mandibular teeth here, there is a canal which is present, which is running within the body of mandible, beta. There is a canal which is running in the body of mandible. This is called as the mandibular canal. It is obviously it is running inside the mandibular. So we call it a mandibular canal. That's a cut end. So I can see the cut end of the mandibular canal above. Okay. And obviously here anteriorly there will be tongue. So tongue banane ki zarurat nahi hai. So the two branches I'm talking about here, one of the branch that you will see will enter inside the mandible. One of the branch will enter inside this mandible, will run through this mandibular canal. Look at that. It will run through this mandibular canal and will come out to supply the skin again. It will come out to supply the skin. That's one branch. And another branch which I'm saying from the posterior division is the one which will go toward the tongue. Tongue beta yahan par kahin hoga. So it is going to supply the tongue. So three branches, auriculotemporal. Then we have this nerve called as a lingual nerve. The next nerve we are looking at here is the lingual nerve. That's lingual nerve. And third nerve that you see which is entering inside the mandible. Well, if a nerve is running inside the mandible, obviously it will be supplying the lower gums and teeth. It will be giving the branches to the lower gums and teeth. So that's why this nerve is called as the inferior alveolar nerve. That is inferior alveolar nerve. We saw superior alveolar nerve were coming from maxillary. This is inferior alveolar nerve which is running in below. Superior alveolar nerve, so three the. We have anterior superior alveolar, middle superior alveolar, and posterior superior alveolar. This is one only, and that is inferior alveolar nerve running inside the mandible. Okay, let's take the lingual nerve first, guys. Lingual nerve, first of all, it is topographically connected to the ganglion, which is somewhere here. Ek hi ganglion bacha, we are done with all the ganglions. What is the ganglion left, guys? That is submandibular ganglion. It is topographically connected to the submandibular ganglion. It is topographically connected to submandibular ganglion. So, char ho gaye hamare paas ab. Submandibular ganglion, otic ganglion, and the two we already discussed. One was pterygopalatine and was ciliary. And that is what we said, all ganglions are topographically connected to trigeminal nerve, right? That's a submandibular ganglion. The function of lingual nerve is a sensory nerve. So lingual nerve is basically taking the general sensation, taste nahi, just the general sensation from anterior two-third of tongue. Lingual nerve is responsible for taking the general sensation from anterior two-third of tongue. That's what the lingual nerve is doing. It is carrying the general sensation from the anterior two-third of tongue. That's the function of the lingual nerve. And it is topographically connected to what ganglion we said? It is to the submandibular ganglion. Ye ek cheez baad mein kaam aayegi. Inferior alveolar nerve, third and the last, this to finish off the mandibular nerve, beta. Inferior alveolar nerve, it enters into the mandible. It is giving off all these alveolar branches, supplying the gums and teeth. And then we said it comes out of the mental foramen as what nerve? As the mental nerve. It comes out as mental nerve. And this mental nerve which comes out, it is going to supply what? It is going to supply the skin of the chin. It's sensory nerve. It's not supplying any muscle. It is just going to supply the skin of chin. It is going to supply the skin of the chin region. Mental nerve. Very last thing, guys. And this is important also. And I'm going to use a different color for this. See, inferior alveolar nerve is entering inside the mandible, fine. But just before the inferior alveolar nerve goes inside the mandible, it gives off a branch which actually comes down and supplies two muscles here in the floor of the mouth here. There are two muscles which are present here in the floor of the mouth. If you haven't heard of these names, doesn't matter. But write the name, guys. The muscle is the mylohyoid. There is a muscle which is present in the floor of mouth called as mylohyoid. And there is a muscle called as the anterior belly of digastric. Anterior belly of digastric. Mylohyoid and anterior belly of digastric. The two muscles which are supplied by this inferior alveolar branch. So inferior alveolar branch gives off a division. This nerve, what is the name of this nerve? The nerve is called as simply nerve to mylohyoid. We call it nerve to mylohyoid only, but it is supplying two muscles. It is supplying two muscles. Which two muscle? One is the mylohyoid itself and one is the anterior belly of digastric, guys. The nerve to mylohyoid, it supplies mylohyoid and the anterior belly of digastric. Anterior belly of digastric. That's the whole story of the mandibular nerve. Now it's time that we should be able to identify these branches on the picture also. Okay, let me have a very quick recap before we go in there. We said the trunk of the mandibular nerve, the trunk division, we have a sensory root and motor root. Both sensory and motor root are uniting at the level of foramen ovale. Then the trunk of the mandibular nerve is the four important thing about the trunk is it gives off nervus spinosus, which goes back and supplies the dura mater of the middle cranial fossa. It supplies one muscle of mastication, that is medial pterygoid. That's a good question. That's a viva question also, that the only muscle of mastication supplied by the trunk, that is medial pterygoid. And the same nerve which is supplying the medial pterygoid also gives off the branch to tensor veli palatini and tensor tympani. The trunk is topographically connected to otic ganglion, or beta otic ganglion nerve ke medial side pe hota hai. So usually in the atlas image, you will not see the ganglion because it is on the medial side of the nerve. Then the nerve divides into the anterior and posterior division. Anterior division is simple. It is supplying the remaining muscles of mastication, lateral pterygoid, temporalis, masseter. And that means the motor branches. But it also gives off a sensory branch, an important sensory branch called as buccal nerve, which will pierce the buccinator muscle. It supplies the skin of the cheek, supplies the mucosa, but it is not supplying the buccinator. Posterior division, three branches. Ali branches. Ali, A-L-I. What is Ali? Look at this. Ali ka A yera, L yera or I yera. Ali branches. Ali branches come from posterior division. Ali kaun hai? A is auriculotemporal nerve. Auriculotemporal nerve, when it goes backward, it loops around the middle meningeal artery and then it supplies the skin of the upper 2/3 of auricle and the temple region, TMJ and parotid gland, right? Lingual nerve is carrying the general sensation from anterior 2/3 of the tongue and it is topographically connected to the last ganglion, that is submandibular ganglion. An inferior alveolar nerve, it goes inside the mandible, it runs within the mandibular canal, comes out as mental nerve to supply the skin, but before the inferior alveolar nerve goes inside, it gives off a branch which goes downward called as nerve to mylohyoid to supply mylohyoid and anterior belly of digastric. आपने बेटा एक चीज नोटिस करी, mandibular nerve, we say mandibular nerve is a nerve of first pharyngeal arch. ये बोलते हैं ना, first pharyngeal arch की nerve is mandibular nerve, and that means it must be supplying the muscles of mastication. Fine, it is supplying the muscle of mastication. It is supplying the muscle of mastication. But if you look carefully, there are four muscles which are supplied by the mandibular nerve, and they are not the muscles of mastication. What are those four muscles? Well, you can already see that. That is tensor veli palatini and tensor tympani. There we have it. And now this mylohyoid and anterior belly of digastric. So these are the four muscles which are not the muscle of mastication, but still supplied by mandibular nerve, which tells me something, that they are also the muscles of first pharyngeal arch. Bhale hi wo muscles of mastication na ho, but they still are the muscles of first pharyngeal arch. Chalo, let me just show you a picture here. Well, we cannot see everything in this image, but yeah, most of the things can be appreciated, guys. And just focus on where I'm telling it first. Now, can you see the trigeminal ganglion inside? So the nerve that is coming out of this foramen, look at this foramen carefully. That is foramen ovale. In fact, just let me copy this picture. I want to show you enlarged view first. Uske baad phir us pe aate hain, guys. Look at this. That, because I want to talk about the trunk first, so let's do it here. So you can see the trunk of mandibular nerve is coming out here. That is from what foramen? That is foramen ovale. I hope you all just keep following my color here. That is a marker. That is a foramen ovale, beta. Or foramen ovale ke piche kaun sa foramen hai? That is a foramen spinosum. That is foramen spinosum. And the trunk comes out. The trunk. Important thing about the trunk is it gives off this nerve. Can you see the nerve which is going back from the foramen ovale? What nerve is that? That is a nervus spinosus. I'm writing very short here. I hope you can appreciate that. That is a nervus spinosus. One thing. Second thing, we have a ganglion which is connected to it, but we said the ganglion is on the medial side. So I can't see the ganglion. Otic ganglion will be on the medial side. We also said it supplies just one muscle of mastication. Can you see the nerve coming from the trunk, beta? This nerve, I'm putting a dotted line on this. Look at this nerve which is going down and it is going to supply this muscle. This muscle is actually medial pterygoid. This muscle is medial pterygoid and the trunk is supplying the medial pterygoid muscle. And I hope you're able to see, look very carefully. Can you see the two branches coming from the same nerve? जो पीछे जा रही है यहाँ पर. The two branches which are shown here, one is this, which is here, and one is this here. That is a nerve going to what muscle? Nerve going to tensor veli palatini and tensor tympani. Things are like quite complicated when you see it in the atlas image. Draw करना easy है, but इसमें थोड़ा मुश्किल है. But once you have an orientation, once you understand what branches, so we can try to expect it. Okay, if this is nerve to medial pterygoid, obviously the two branches coming from there are the one which are supplying the tensor veli palatine, tensor tympani. Those muscles are there, guys. Look at this. These two muscles that you're looking at here are tensor veli palatini and tensor tympani only. These two muscles are tensor veli palatini and tensor tympani. Right? Trunk की बातें हो गई. I repeat again. It gives off a branch which goes back. That is what? That is nervus spinosus going back here. It is topographically connected to what ganglion? Otic ganglion, which you can't see. It is on the medial side. Then we said it gives off a branch. Then we said it gives off a trunk gives off a branch to which muscle? To the medial pterygoid, and the same medial pterygoid is going to supply the two muscle, that is the tensor veli palatini and tensor tympani. So that is about the trunk. Anterior division, beta, this here is the anterior division, the one which I am going to highlight for you. ये पूरा anterior division ही है. Look at that. That's it. बस यही है anterior division में. This is anterior division, which we said the purpose of anterior division is to supply the muscles of mastication. So look at this. It is supplying the temporalis muscle by these branches. It is supplying the lateral pterygoid muscle by all these branches. That's how it is going to supply. Masseter muscle will also be supplied by this. Let's not go into that detail. So all these branches are simply supplying the muscle of mastication, which are partly removed from this to show you other things here. But the important thing to note is that it also gives off a branch which is called as the buccal nerve. Can you see that? Anterior division is also giving off the buccal nerve, and look at this buccal nerve is going in here and it is present outside the buccinator muscle. It is not supplying this buccinator. It is piercing this raphe and the buccinator muscle from the back, but it is supplying the skin in this part here, the skin of the cheek, the mucosa of the cheek, but not supplying the buccinator muscle. So this whole thing is the anterior division. तो एंटीरियर डिवीजन में कोई बहुत ऐसे अलग से आपको बहुत अच्छे से इजीली अप्रिशिएट नहीं होता. That's anterior division, which is giving off the branches to the muscles of mastication, and the one long nerve which continues here, that is a buccal nerve. Now let me take you to this picture here. Posterior division is something which you can really appreciate nicely, guys. If you look at the posterior division, 3 branches and all 3 have some typical feature. Auriculotemporal nerve. Now can you see auriculotemporal nerve which is making a loop here and then going back? You already know that auriculotemporal nerve is making a loop around which? What artery? Middle meningeal artery here. So that is the auriculotemporal nerve, and it is looping around the middle meningeal artery and going back. And we said auriculotemporal nerve will supply the skin of the auricle and temple. It is supplying the TMJ, temporomandibular joint is here only. We have a head of mandible here, so that's a temporomandibular joint. But a parotid gland भी यहीं पे कहीं होगा, so it supplies the parotid gland. So all surrounding structures. Then we said lingual nerve. Look at the second branch which is going downward here. That is a lingual nerve. They have not shown the lingual nerve completely because tongue is not shown in this picture. So that's a lingual nerve which will be topographically connected to what? Submandibular ganglion, not shown here. And then supplies the anterior 2/3 of tongue. General sensation from anterior 2/3 of tongue. But the one which is clearly shown here is the inferior alveolar nerve. Like look at this. This is inferior alveolar nerve which is entering into the mandible. Can you see that? And it is running in the mandibular canal. It is running in the mandibular canal. It is supplying all the gums and teeth below. That's why in alveolar. And then comes out as what nerve from this foramen? That is the mental nerve coming out of this foramen here. And if you look carefully, can you see a branch here which is given off from the inferior alveolar nerve? Guys, there is a branch coming from the inferior alveolar nerve which is running downward, will go below the mandible and supplies 2 muscles there, beta. One muscle is shown here, the mylohyoid is shown. This is a mylohyoid muscle. And one muscle will be somewhere here like this, that is anterior belly of digastric. It also supplies the anterior belly of digastric also. We will be discussing these muscles in the neck part here. At least try to remember the course of the nerve. If you remember even the 60-70% of the nerve course here, this is really going to make things easy for you. But a confusion ही nerve में आती है. People do get confused with such nerve. Imagine you're just looking at one nerve right now. You're looking at the mandibular nerve. Imagine you have maxillary nerve here. If I draw all the branches of maxillary nerve here only, so kitna complicated ho jayega? Posterior superior alveolar nerve, middle superior and all. And then we have maxillary artery, which is having 16 branches in this region. We have pterygopalatine ganglion, which is present here, which will be giving off the branches. So, when you try to look at all the things collectively, it becomes very complicated. Head and neck sequencing, dividing the topics in part, and then later on collecting them together is what is needed here. And very few people are able to do that. And that's why, I've even seen the postgraduates who have done their PG in anatomy. They still find the head and neck very difficult to understand for themselves. Imagine, forget about teaching to others. They find it difficult to understand themselves. I hope I'm able to make these branches a little clear to you. And the schematic diagram is the best. Keep that in mind. This will help you give an orientation. Once you look at your schematic diagram and then you try to compare it on any of the image, you will be able to identify those branches.